Roughly 20 million Americans who rely on the Affordable Care Act for their health care are starting the new year with higher bills. Pandemic-era tax credits that lowered premiums for people near the poverty line. They expired on the last day of 2025 yesterday.
10 News reporter Olivia Daigle joining us to explain the stakes here, the higher bills facing families, and the decision by Congress to make no changes before the benefits expired.
And when they couldn't make that decision, it resulted in the longest government shutdown in U.S. history. Democrats wanted to extend the subsidies. Republicans thought it was too expensive to do so. Congress ended the shutdown without extending the cuts, and now around 650,000 Tennesseans are going to see higher premiums.
For more than 20 million Americans who get health care through the Affordable Care Act, tax credits have become somewhat of a lifeline. Democrats and Republicans butted heads over whether to extend them, resulting in a government shutdown. Republicans were against it, citing the cost. The Congressional Budget Office estimates the advance credits would cost $350 billion more than the status quo credits in the next 10 years. Democrats were in favor of extending the subsidies, helping the cost of health care for people near the poverty line. January 1st, those subsidies, which lower the costs of premiums, are gone, and its impact, in part, depends on how much money you make. According to data from the Kaiser Family Foundation, a family of four making $40,000 or less will see premiums go up around $840 a year. But for families that size making more than $90,000 a year, premiums would increase close to $4,000. The study found that a fourth of people who would see premiums double would go without health care, and a third would look for a cheaper plan. In addition, the amount of people using ACA health care plans has skyrocketed. In Tennessee alone, there are 643,000 people using marketplace plans, but that number has more than doubled from 2020.
Now, we also want to hear how this is impacting you, and we have a survey you can fill out right now on our website. That's WBIR.com.
Olivia Daigle, we appreciate it. We'll continue to follow it in the new year.